Hey, welcome back, everybody. It's time again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show, that shows you a path towards a healthier life. One conversation at a time. And today we're smiling because we have with us a very bright, smiling person to talk about a very serious issue here today. Dr. Trinh, bring us in. Who we got and why?
All right, we have April Durant here. Welcome, April. And
thanks for having me.
We're going to talk a little bit about what she does and why it's so important, not just for your teeth, but for the rest of your health, including your brain health and things of that sort. We've talked in the past a little bit about the importance of dental care, gum care, and how that is actually linked to a number of health conditions if not taken care of, especially what we've been seeing in the area of brain health and Alzheimer's and things of that sort. There's been a good number of reports that's been out showing that poor dentition, poor dental health care has been linked to a higher risk of both heart disease, heart attacks, and brain health, which is very interesting, actually, when you think about it, why, taking care of your teeth actually connects to all that, and how April is part of that solution, actually.
Welcome, April. Welcome, April. So what is it you do, April? You're not just a dental tech. You don't just help people keep their teeth clean and healthy. You do it in a way that I've never thought of before.
What I'm doing, I'm so happy to be here because I feel like what I'm doing is fairly new in the community and it's not being utilized to its full extent. I'm so excited to talk about what it is I do. So as Dr. Trinh was saying, as we go through our lives, a lot of different health conditions stem up, and a lot of the health conditions that we see, diabetes, heart disease, all sorts of things stem from inflammation. And something that a lot of people kind of forget about is a big source of inflammation actually comes from our mouths, our oral bacteria. Especially as we age, a lot of different conditions are exacerbated by this inflammation. And one way that we can keep ourselves healthier is to keep our mouths clean. And so what I noticed and kind of how I got into this industry, I've been in private practice now for 10 years and work in a great office still in Seal Beach. A lot of my elderly patients kind of stopped coming in during COVID. And I, had this list in my mind of all of these people who I know were coming in every 3 months. They really needed to come in for their oral health and I wasn't seeing them. And I said, I got to go find them and I have to get out and go see, how I can serve them where they are. And so what I did is I got licensed as an RDHP, and we can go into that, what that is. And
let's since you brought it up, let's bring it out. What is an RDHP?
RDHP. It's a long acronym. We're basically mobile hygienists. So it's a registered dental hygienist of alternative practice. And what we get licensed to do is we go into the community to provide preventative dental services for people who are unable to get into the office. So we can go into health shortage areas, we can go into assisted living communities, hospitals, schools, and provide them with the services they would receive from a dental hygienist in the office, only without the presence of a dentist and a dental office there with us. And so there's many different avenues.
Is that something you need a special license, a certification for? I thought you're a dental hygienist. You can just come over to my house today and do this if you want. I didn't know you need special permission or training.
Yeah. So not so much. So the licensing for this, it's a course that you take. It's a 150-hour course, and wow. It teaches you how to problem solve a lot of medical conditions, emergencies that you would run up against. People that you're seeing are typically health compromised. There are a lot of things that you need to be aware of when you treat somebody with these conditions. You are opening up essentially wounds in their mouth and you're allowing bacteria into their system. So what are the benefits and the risks, and how do you treat them, different, ways that you can see different types of people, learning to deal with people with Alzheimer's, dementia, learning to deal with people with disabilities, intellectual disabilities, anxieties, kind of that step above and beyond. So what I tell people is we're kind of the nurse practitioners of the dental world. And that's a good way to explain it, because we can treat now independently. We're still under the guise of a dentist. We still have relationships with dentists, and they are our primary referring sources. But we step in, and we're kind of that mid-level person who can treat them where they are, find the issues, keep them healthy, and kind of bridge that gap.
Interesting. So it's kind of like house calls from a doctor, except this is house call for dental hygiene.
Exactly.
And is the dental world like the doctor world in general? It's hard to see the doctor, harder and harder. They're busy. They're seeing more and more patients. There's fewer of them. I don't know, whatever drives this. Their management practice, the guidelines for Medicare says you can only see a patient for a few minutes, so they don't. And that seems to be what's driving the need for nurse practitioners and other sorts of something less than the doctor, but something more than just a typical nurse or hygienist in the old days here.
So what I say is a dentist's time is very valuable. And I want them to be able to spend time seeing the patients who need, root canals, who have infections and, need to come in. They have crowns, they have fillings, all of the stuff that keeps them busy all day. They need to be immersed in that. They need someone who can step back and be on their team and come in and help diagnose the issue, so that when the patient does need care, they're able to get in for that care that day. There's no waiting. There's no, let's diagnose, let's take some x-rays and see, and then put you on antibiotics and then come back next week. I can be that person to come in, take the x-rays, diagnose the issue, talk with the dentist, take the photos. We can say, yes, we need to get you on this antibiotic. You need this treatment. I will schedule with a mobile dentist, and they will come in, whenever this needed, the next day, next couple of days when the infection calms down, and they're able to get that treatment immediately. And it's glorious for a lot of people.
Are you like the PCP, primary care physician, where you kind of triage, and then if needed, you send the specialist in, which is like the dentist type? Is that a good analogy? Or
that is a good analogy, yes. And what I do with my diagnostics is very unique, and not many dentists know that I'm doing what I'm doing. So I'm getting, a community of dentists who are willing to try this model and to really embrace it, and working with them and making the awareness that us RDHAPs do have this ability to help them treat their patients better.
Is there a resistance, or are they like, wow, that's a cool idea?
Once they know what I can do, I'm getting very positive feedback. The office that I do work in, a couple of days a week, I honestly get a lot of my patients directly from those dentists. They love what I'm doing, and they work with me, and they're very quick to respond and to review x-rays and diagnose.
Because I can see it going both ways. On the one hand, you're freeing them up from and letting them do what they do best, which is why they went into dentistry and what the need is. But on the other hand, there's a fear the patient's not coming in. Somebody's seeing them somewhere else. Maybe they'll go somewhere else. Maybe they won't come in at all. And so I could see a certain fear of, because the whole business model is based on get them in, and then we'll figure out what to do. Get them back, then we'll keep servicing them. It's not, I wonder if they fear that somehow you're going to, I don't know how, but you're going to keep people from coming in. You're not going to, they're not going to need to see a dentist as often or something. Any fear like that?
So the beauty of what I do, and the beauty of the RDHP license, is we have to have a reason to see these patients. They have to have a reason why they are not able to get into the dental office to begin with. So I'm reaching these people who normally wouldn't be able to come in, or they'd have to hire a caregiver and and do all this. So I'm reaching them, and when they normally would not even come in. So I'm doing the preventative work. I'm doing the cleanings. I'm taking the x-rays and the photos. I'm triaging so that the dentist can therefore get better production. And
well, and you're also opening up a population of people who wouldn't
Yes.
go to the dentist anyway. It's
Yes.
not keeping healthy people from,
Right.
I'll just stay home, I won't go to the dentist, I'll do it this way. It's people who ain't going to the dentist. Now, let me give you a story. I'm a great storyteller. And I've told the story many times of taking care of my late aunt, who was in her 90s when she died. And she lived alone, way out in the desert, a couple hours away from me here. And she was very feisty and very independent. So she didn't want to do this, didn't want to do that. And one of the things she didn't want to do was go to the dentist because, hey, I'm old. Who cares about, I'm not trying to worry about keeping my teeth. I'm 90, so what if I get something here? It's hard. I can't drive. I can't get in and out of a car. You can't get here. And so she would less and less. And I hate to admit it, I was kind of okay with that. There was a million other doctor visits I had to arrange. Just taking her out to get her teeth cleaned, stupidly, didn't seem like a priority at 85 or 90 to me. There were bigger fish to fry. She had cancer. She had other sorts of things. There were enough other doctor visits I had to go without driving out just to go take her to the dentist. And I look back now, and you're telling me that's not a good idea because this is another source of infection. You're chewing. Your mouth is so prone to getting. I think of all the stuff that goes into your mouth, and the gums are like right there. The blood vessels are right there. I never thought about getting into her body and causing other problems. I was just thinking about her teeth, and who cares about her teeth? She's 90.
So what I tell people, I'm going out and giving presentations to the community. I'm going into assisted living homes to talk about this because a lot of people are unaware, and a lot of, the family members who are taking care of these residents and in charge of their dental care are unaware of the importance. So I say there's the big six here that we're trying to manage and control by controlling your periodontal disease.
Which are?
You're controlling your heart disease. We're lessening the bacteria that's getting into your bloodstream. Every time you brush and floss, you're getting that bacteria into your body. It's going into your blood. It's attacking your heart. So we're doing that. We're getting rid of your diabetes. We're lowering your inflammation. It's going to help your A1C. Your diabetes and your periodontal disease are directly related. When you have bacteria in your mouth, it's increasing your body's inflammation, which is increasing your A1C, and your body is trying to fight that infection. And the diabetes lowers your immune system and counteracts that.
Okay, because I was searching for that. I thought, diabetes, what the heck does that have to do with my mouth?
Right.
It doesn't seem to do anything with my mouth here. His Dr. Trinh fills his mouth with his breakfast here this morning here.
We have actually been able to diagnose patients with diabetes based on the condition of their mouths.
Really?
They come in and suddenly there's worsening of periodontal disease, there's redness, there's bone loss, and we say something is going on here. And sure enough, we've diagnosed their diabetes. We get their gums under control. We get their diabetes under control, and everything is maintained better. And so the third one, I always say, we can prevent a stroke. We prevent that bacteria. The bacteria that gets into our bloodstream is actually found in the clots of stroke victims. And that's a very harmful bacteria. Kidney disease is also directly affected to periodontal disease. Alzheimer's, dementia that we talked about as well. The bacteria crosses our blood-brain barrier, affects our brain's nerve cells. And the last one I say is aspiration pneumonia. That's a big one in our assisted living communities, our nursing homes.
Huge.
You breathe that bacteria and it goes straight into your lungs and can really cause a lot of problems. So there's a lot of reasons why it's very important to keep, especially our elderly, keep their bacteria low in their mouths and keep up on those regular dental visits.
So you just rattled off a half a dozen of probably the hot button issues for aging people. For my late aunt, diabetes. She was always borderline diabetes. She ate candy and just sat around all the time here. Heart disease, Alzheimer's. They all, at some point, everybody starts getting some symptoms of Alzheimer's, dementia, whatever as we age older and older and older. Pneumonia is what finally killed her sister, my mother. It wasn't all the million of other terrible problems she had. It was just finally simple pneumonia that got her. And could she have gotten it? I don't know, just from, I don't think my mother went to the dentist at the end. There was something about going to the dentist that seemed like just a luxury at the end. You know, when you're young, you want to maintain your teeth. You want to maintain your smile. That's what all you're thinking about here.
Cosmetic, that's it.
It's cosmetic, right. And as you
How
age...
does it look? Can you give me a diagnosis?
Right. How much are veneers? How much
Yeah, right, exactly. Doesn't look bad. Looks okay.
That's better.
Okay. I'll give you a passing mark here. But as you get older, my aunt was less worried about how her teeth look. She wasn't certainly going to get a veneer or whatever, unless something broke. She needed a crown or something like that. Something severe happened. Then yes, of course, you got to get to the dentist. It hurts. But if it didn't hurt and she didn't care how it looked anymore, then why am I even bothering with my? And if I lose a tooth, you know, when you're young, you say, oh, I got to maintain my teeth because they could last my whole life. As you're towards the end of your life, that didn't seem to be a priority about her teeth. And you're saying it's the pathway entry for so many other problems.
100%. 100%.
So you know, when you go to the dentist's office and you sit in the dental chair and it kind of goes back and you open your mouth and there's a light, you know,
right,
going into your teeth.
I hear a bad joke coming here.
How do you do that at home? Do you sit on a chair, lay on the bed, and open your mouth? What do you do?
Well, the ideal situation, if people are somewhat mobile, is to get them in my chair. I have what's called a zero gravity chair. Have you seen those?
Ooh, the one that goes like this.
Yes. And so you're sitting like this. It's easy on your back. It has a pillow rest. It is the most comfortable chair. You sit in it normally, and then I just lay it back. And so they're not all the way back. They're still sitting up, but they're low enough for me to sit at. So that's the ideal situation.
You bring your chair into their home?
I do. I made my chair into a backpack. And I put backpack straps on it, so I'm able to carry in all my equipment at one time.
Wow.
So ideally, I get them in that chair, but if they want to be in their recliner chair, I work on that. If they're in a wheelchair and need to stay in their wheelchair, I work with that as well. If they're in a hospital bed, any situation they need to be in,
And where do they spit? That's the other thing I do in the dentist's office. They do something, and then I have to spit. There's always a little.
They spit on the floor.
Yeah, well,
in their living room.
My aunt did that anyway, right?
This is my mobile suction unit here. This is my little compressor. It's very small.
Wow.
So I have that, and I bring that in with me as well. I have a couple of things here. People are always love to see this. So when I take mobile x-rays and photos, this is my x-ray machine here.
You can get an x-ray on that machine?
Oh, come on. That looks like a blender. That looks like a blender.
It's very small. It's compact. It's very light.
What's an x-ray? Like, where do you put that on their face?
So the sensor goes in their mouth, and then I hold this, about this far from their face, and it goes straight into my laptop and uploads directly into their chart, and I can email it directly from my computer right then and there.
Holy moly.
Yeah.
Talk about remote almost virtual care.
Yeah.
Wow.
Yeah.
Well, was this technology recent, or has this been around for years? I didn't know there's a mobile x-ray unit that you could take with you.
They are getting better and better and better. Kind of the original unit came out probably about 10 years ago, I'd want to say. Right. And they keep getting lighter and more convenient and easy to use. And now the software programs that we're able to use are cloud-based. So, you have Wi-Fi, and you can log in and you can take an x-ray anywhere and put it directly onto your software. So
will this eventually interface, or maybe it does now, with the dentist under whom you're licensed or work? I don't know how this all works, but you say you have to be associated with some dentist, and so you say, look at this, hey doc, I think we've got a problem here, and you email it to them, they go, yeah, let me look at this. Yeah, wow, that does look like a problem. Better bring them in.
Yeah. So all my referring dentists are able to have a platform within my software if they want to log in and see, the full chart at any point, or I can email them just a sheet with the x-rays and photos that I specifically saw, and they can bring it up as well. So
do you need a referring dentist, or can a physician refer a patient, or
physicians can refer? So the way this works, so we have a dentist who is signed up on our license, and he is our official referring dentist, the person that we communicate with. They have no liability with us. They are just somebody that we've established a relationship with, and we know that they're there for us. If we see a patient for longer than 18 months, we need a referral from a dentist or a physician stating that they are still able to receive this home care, that they cannot make it into the dentist.
Right.
So we initially make that determination. But if we're seeing them for long periods of time, we just need that, yes, they still need that service at home. They're unable to get into the dentist.
Is this just for the homebound, or those who are have some difficulty getting in? Or can I just say, I don't want to go to the dentist. Come on over here and check me.
It's simply for the homebound, unless you are in an area of dental shortage. So if you're out in a rural area, then we can actually set up a brick and mortar practice in a rural area and have patients come into our office, or we can go in and see them. And then there is no need for the homebound.
You're the traveling judge. You're the traveling preacher, that there is no local place for them to go. So you come in periodically and conduct this service. Yeah.
So what is, how do you define homebound? So is it somebody who has difficulty walking? Let's say I can still ambulate and walk, but I use a walker, so it's hard for me to get to the dentist. Is that homebound or not?
Absolutely.
Really?
If you need a caregiver to drive you and you can't get a caregiver easily, if it's hard for you to get in, if I have patients who are just in wheelchairs, they're otherwise completely healthy, and they do get around if they have to do something, but it's hard for them to get in the dental office. The dental offices have narrow hallways. It's hard for them to get out of their wheelchair into the chair, and they would rather just have somebody come home to their home where they can be safe and not feel judged, and have that treatment there without all that hassle. So that's considered homebound.
So homebound simply means you're older, you're frail. It doesn't mean that you can't walk anymore, but so what if you can walk, but you don't have a car? Is that homebound?
Yeah. Any reason why you can't get into your dental
obstacle.
office, and you don't want to see perfectly healthy, but let's say there's an older person who just has anxiety of leaving the house.
Yeah.
I mean, that was my grandmother. She didn't leave the house the last 3 years of her life.
Wow.
And how nice would it have been, for someone to come in there and take care of her teeth because she didn't want to get out, and that would have been an option that would have been appropriate for her.
One of the surprises is I took care of my aging mother, and then helped with that, and then was full-time with my aging father, and then aging aunt, who was the last of the tribe to leave, was how huge every little barrier became. My mother had anxiety. My aunt could barely walk. My dad could walk but fell all the time. And so doing anything suddenly became a major hurdle, a major project, getting them to the bathroom at the end, getting them out into the car. How many times did they fall or gash or do something? The anxieties that associated with that, the time off I had to take to get them there because they couldn't do it themselves. These things that we take for granted became giant hurdles, and eventually turns them into what looks like or is a homebound person. Not because they can't, because it's not easy, they won't. Yeah.
So is how is this paid for as far as insurance and all that?
She does this for free. She's an angel of mercy. That's all she does.
Yeah, it's just because I love it.
Yeah.
So that's where the big struggle is. So I'm sure you're aware of the whole dental insurance situation going on in the world right now. And unfortunately, Medicare's dental coverage is non-existent. You have to get an Advantage plan. You have to pay for it monthly. And unfortunately, a lot of these people, they don't want the insurance because they aren't going to use the dentist they've been at home. They haven't had their teeth cleaned. And, they're like, I'm not going to go get new crowns and this and that. Why do I need insurance? And, or if they do, they have, some free insurance that doesn't even cover anything, one cleaning a year, maybe, and so most of what I do is just, fee for service. And I, just take cash for that. I can bill their insurance if they do have an insurance company. But for the most part, I say, it's easier just to pay cash. By the time you pay a premium for an Advantage plan, you're paying $40, $50 a month. That adds up pretty quick. You're better off, just keeping up with your preventative work and going from there.
And what does it run roughly? What does a visit cost to?
A dental cleaning with fluoride treatment, gum irrigations, products, everything is only $175. And so it's reasonable. It's pretty comparable to the dental office. And then if they need full dental x-rays with all the referring services, everything is $225 for the mobile x-rays. So it's really comparable to going into a dental office. I think it's about $20 more than going into my office.
It's very reasonable because you're not like needed like every month. You're right. It's like twice a year maybe, or depending on how it is. So it's actually pretty reasonable. Are you hoping to contract with like Medicare Advantage, or is that not necessarily a good thing because of their low reimbursements? Or
that is my ultimate goal. So what I'm doing right now, I'm trying to branch out a little further than just individual home visits. The Medicare doesn't make sense, unfortunately, all of the work and driving and everything to one home. But I am getting into assisted living communities where I'm able to see multiple patients at a time. I can set up in a familiar room within the facility and see multitude of clients. And for that, it would make a lot more sense. Yes. So I'm trying to work with these facilities to see kind of what insurances are out there, what people have, and if it does make sense to get.
In the facilities, they're mainly like Medi-Medi, right? Straight Medicare, Medi-Medis. Those are the folks you
guys have stopped talking English now here. I have no idea what you're talking about. Medi-Medi, berry, bingo. I don't know what you're talking about here.
Although I'm not sure if, being on like the Denti-Cal plan is going to be, worth it or not. But
isn't that a sad reality? And I'm not saying
very sad.
I'm not trying to pick on you guys, but at some point you're disincentivized to pursue people who really medical really need it.
Yes.
And yet there is a plan, but the reimbursement is so low, the paperwork so strenuous, I'm told over and over again, that you guys just say, you know what, I'd love to help. And I'd love a little extra income, but it ain't worth it to you. Don't they realize this? Don't they? Is there any movement afoot to fix that, particularly with dental care? Again, probably one of the reasons my aunt didn't go to a dentist is she didn't want to pay that extra Medicare Advantage premium. As little as it was, she thought, I don't really need it. And she was on a very, very tiny little fixed income, a couple $1,000s a month. So every nickel counted. And I'm sure that was one of the things she cut.
And unfortunately, by cutting that and getting dental disease, it affects everything else. With your health, your brain, your heart.
I think the solution, and what I try to get across to a lot of my patients and to their family members who take care of them is you cannot let insurance dictate your health. The second you have that mentality of I can only do what my insurance allows, you are putting your health at risk, and you need to put that aside and say, what do I need? What is best for me? And I need to be coaching my patients and their family members as to what to do, because they have a lot on their plates. They don't have time to research dental insurance and figure out what the fees are and how they're going to get about it and what dentist covers this and that and that. And so it is part of our responsibility as providers to be advocates and to explain the importance of this and what insurance, if any insurance, is worth it or not.
I hate to admit it, but I was your worst enemy. I encouraged my aunt, forget about your teeth for now. We got bigger issues here. You've got cancer. She's got borderline diabetes. She had all sorts of other problems. And it was like, come on, we're not going to worry about your teeth right now here. They look fine. Unless there's a pressing emergency. Yes, right. If you broke a tooth or something. But at that stage in her life, I guess I was not thinking, and nobody ever educated me otherwise. I didn't think I thought the teeth were something that you could sort of let go later in life.
Nope, not at all. Not the case.
If you let go, it's going to go.
Yeah. She didn't like that. You got a little slap on the.
Don't talk and eat.
Is that what it is?
Yeah,
Okay.
the boss Jenny.
Oh my
wife.
goodness, my mother would slap me too if she was alive. She'd be there. She'd come over. She'd slap you through the thing there. Don't ever talk.
It's a good thing I'm done with breakfast.
I got to tell you though that it's an ongoing theme on this show. One that I guess I didn't think about enough. I don't know if your audience thinks about enough. This idea of telehealth, where when I was a kid, everybody came to you. The family physician came to you. The kid was sick. The doctor came over. He couldn't make it to his office. He came. That went away a long, long time ago, and it was a centralization model. We can get more people in quicker, faster, more efficiently if everybody comes to the office. Now we seem to be devolving out of that again, where we have, particularly for people who getting to the office is hard, we're trying to find ways to do telehealth, to do other sorts of things in the home. We've got COVID now, a whole nother barrier of problems to get to the office and stuff here. Is this the wave of the future, where offices will be for emergency visits for important stuff, and less important stuff will get monitored and performed remotely or in your house? Do you think this is part of a growing wave? You obviously do. You've chosen this path here, but talk about that. Is this where medicine is going in general?
I have seen such a growth because of COVID in this sense. I went back in March. There's a association called the National Mobile Teledentistry Association.
Of course there is, right?
And they held a conference. It was their third conference. We had it in Las Vegas back in March. And it has grown exponentially over the last 3 years. And they expect it to double by next year. And the people who were speaking and the advocates from all over the country, and the ways they were trying to create new laws and to get this legislation in quickly to allow this to become a reality it's amazing. And unfortunately that's kind of what our barrier is right now, are the laws in place for us to be able to go into homes. What is the liability? What is the cost? Can we be reimbursed for our home visits? It's not really set up very well right now in the dental insurance model and all of this.
So is there a fear of, I'm going to come to your house and I'm not a dentist, but I'm the next level down. So I'm a trained person, but I don't have the dental license. And therefore, because you're not the dentist, you miss something, you don't see something. And therefore, you're held liable now. If I'd been to the dentist, they would have caught this. Is there a fear that, and yet everybody's telling me, but the dentist can't see you, won't see you. It's hard to see you. That's why they created physician's assistants and nurse practitioners and all these other levels of care that I never heard of before when I was a kid. You went to see the doctor. You didn't go to see the physician's assistant. And yet, in many cases, in my parents' cases, many times the physician's assistant knew more than the doctor did and saw them more often. And really, I hate to say it, probably provided better, not just cheaper care, but better care. The doctor was sort of way up here dealing with big issues, and the day-to-day stuff, I wondered somehow the nurse practitioner could do a better job.
So it's a huge fear for dental hygienists who are doing this. And this is why I'm one of the few that actually take x-rays and do this level of service, because they don't want to get involved with all of the liability that does come with that. And
You did something wrong. I'm going to sue you, or something happened in the middle of this.
So if you take an x-ray, and so you're liable for those results, as far as not treating, or how are you liable?
So I have to have a dentist review them, and the dentist that I have review them is now liable. So I need to make sure that they are diagnostic enough and that the dentist can properly diagnose. Otherwise, my service is for nothing. And it is my responsibility. I spend a lot of my day and time, getting a hold of the most, closest mobile dentist who can see this person and communicating the care and all of this. And I don't just show up and clean your teeth and leave. It's, I spend double the time I do when I'm with the patient. I spend that same amount of time with all of the after work and the referral care and everything that comes with it. And
it's comprehensive.
That's really
very
a key
comprehensive.
thing.
It's a lot of work.
Because you would think you just show up, you're like a hairdresser. You come up, you do my hair, and you leave, and there is...
Nope.
And never think about me again until the next time I need you. Come on out. I need your service again here.
Well, I mean, even today, I got an emergency call last night that, someone's, mom, she's living at home and she has an infection. And so we called in an antibiotic and they're sending me, and I'm the one that's going to go. And, she has some loose teeth. She has an obvious infection. That's all the doctor could tell me. And I have to go in, and it is now my responsibility to be able to help this person and diagnose the problem and communicate with the dentist. So I didn't get called to clean her teeth per se. I'm going to go in there and make sure everything's clean and, get the bacteria out of there since she's on the antibiotic and we're going to do this. But her main concern was getting me in to diagnose and to help. And she can't get her into an office, and she can't get a mobile dentist to come in today because they are so swamped and busy doing larger procedures. So,
wow.
So what led you to this? You had a nice little gig. You're at a regular dental practice. You're still there. Why do you need all this headache and hassle? Just show up and punch the clock and go home.
The hygienists I work with think I'm crazy. They're like, you make great money. You sit in an office, all your patients show up, you have no liability, no responsibility. What are you doing? But my heart is led for this. And I feel like this is my calling. This is my passion. There are so many people out there who need my help. And the more I do this and the more smiles I see and the more hugs I get, and the more I realize that this is a service that is necessary and that needs to be advocated for. So I'm hoping to get more people on board. I'm spreading the news with hygienists that this is something that, yes, it is difficult, but it is so rewarding. And I would love to hire hygienists out there who want to do this, who don't know where to start. I've hired the lawyers. I know what to do. I'd love to teach.
I've hired the lawyers. That was the first thing. I got the lawyers. I got the.
But it is. There's a lot that, because people don't know how to do this. They say, you call the dental insurance companies, and they say, wait, you're a hygienist, but you do this, and so it's there is a lot involved with it. So it's not an easy feat. It has cost me a lot of money and heartache and everything getting it in.
Wow,
but
you got to really, and yet it seems so logical. It seems so needed. It seems so obvious that there's a large population that can't, won't, don't go to the dentist. And this is, despite my ignorance on the subject, an important issue, particularly for elderly people, if you want to prevent stroke, Alzheimer's, other sorts of things here.
Right.
Talk about how we age. Why is it that we just assume, it's a toothless old granny. Their mouth smells. They're old. Who cares anyway? If I walked around with my mouth smelled or I lost a tooth, it would be a disaster. We're so concerned about our mouth when they're younger, and when we get older, that's just part of it. Your teeth fall out, everything. If we just accepted something that doesn't have to be accepted? If we just accepted that you get old and this goes?
You know, it's sad for me because we treat our elderly like children, where they don't know what's going on. They don't really care, you know, if they're missing a tooth. They don't care if their breath smells. And that is a falsehood that needs to be corrected.
Yeah.
These human beings have lived a life that is worth celebrating and worth preserving and worth keeping them at a state where they feel respected. And the biggest thing that I see when I go in and I do these cleanings for people who haven't had a cleaning in years, they walk around, they keep their mouth closed. Yeah. They don't want to talk to people.
Right.
Mm-hmm.
They don't want to eat foods that they love because it hurts. And I go in there and I do a simple cleaning, get their gums healthy. Next thing you know, I'm getting calls from these facilities and they're like, you know, Mrs. Jones has been walking around like she owns the place, smiling at everybody, you know, talking about how happy she is. And to see that happen just goes to show that, you know, these elderly people need this respect. They need
humans,
this
and
care.
we treat them. We don't treat them as it's not important anymore how they look or how they. And nor do we think of it as a priority in their health care. I didn't prioritize my aunt's dental. It was way at the bottom. If it was off the list, that's one we don't have to worry about anymore here. Let's just focus on her cancer and some other things. Those were enough problems in office visits. So let's worry about her walking. Let's worry about all the other things that she was burdened with.
And you have to listen to them. And if you do listen to them, they will talk about their teeth, and they won't make a big deal about it because, you know, they realize that they have other things to worry about too, but they want their teeth taken care of, and they need someone to listen to their concerns and to really address them and not just blow them off and say, oh, no, they're fine. They're fine.
That was me. Because my aunt occasion would say, you think I should? I thought, yeah, it's fine. The teeth. We're not even talking about your teeth right now. Who cares about your teeth? It's like, to the day she died, she always wanted to get her hair done. She came from that generation like my mother, where every week you had to get your hair done. And I was always like saying, let's just take that one off the list. No, that was one that she held on to the day I think she went to the hairdresser a week before she died, you know. There was just, that was a priority to her. That's in some way she held on to who she was and her appearance. And I'm sorry to say, as her sole caregiver, probably poo-pooed, put off, dismissed the teeth as irrelevant at this point in your life. I'm sorry, Aunt, wherever you are here.
Time of confession here.
Yeah, time of Catholic, so I got to do a confession once in a while here. Well, how do people reach you if they want to learn more about this?
They can go to my website, Brightwork Dental Hygiene. So it's BRIGHTWORK, Brightwork. dentalhygiene.com, and they can find my number, they can find my email, they can send me over an email if they would like any presentations to be given, if their family members are at a facility, contact me. I can come in there, I can give presentations, demonstrations, toothbrushes, whatever they need. I'd love to come in and talk, set up cleanings, whatever they need.
Are you in any retirement homes or facilities now, or are you hoping to get in?
Yeah, so I'm over at Westmont of Cypress. I'm over there quite frequently. Today I'm going over to Clearwater in North Tustin, over there. Sunrise, Seal Beach, I've been over there. We're doing a road show this summer. All of us mobile providers. We're going around to different Oakmonts and Sunrises facilities across Southern California, and we're going to be doing little mini health fairs on Saturday mornings. So you'll probably see us around with some other mobile providers. Dispatch Health is a mobile urgent care that I've been working a lot with. I love them. So they're putting on this mobile road show that we're doing.
We should have them come on the show sometime. I didn't even know there are mobile. I don't know the world of mobile anything. I only know brick and mortar. And I think there is a mobile world being created
The mobile urgent care is great. They, they do anything, they can bring in x-ray equipment if you have small fractures. They do sutures, antibiotics, whatever you need, they will come to you, and they are covered by Medicare completely, which is amazing. There's mobile opticians. So, top opticians.
Mobile obstetrician. I need help with something.
Opticians.
Opticians. No.
Yeah.
No.
So,
no mobile
yeah.
optician.
I was wondering about that one. That sounded wild to me. Okay.
No, yeah, I don't know about that, but there's mobile podiatrists. We're all out there. We're a little community that's traveling
podiatrist.
around.
There was one that never occurred to me, but that was a priority because my aunt couldn't reach her toes. And she couldn't cut her toenails. And they looked like some kind of a creature with claws on it here. And I wasn't really comfortable going down and trying to snip these things and whatever. And so she had a podiatrist that would come out, and I thought that was ridiculous at first. And I came to realize, no, that's an important issue.
It's so important, especially, diabetes and different things. It's necessary. Absolutely.
Isn't John Nguyen with Dispatch Health?
Yep, he's the guy. Yep.
He's the guy? Okay, yeah, I chat with him off
Well, let's get him on the show. I'd love to hear about all this world of mobile. You've opened the door to mobile services. I didn't know there's a whole group of you out here.
Yeah, we cross paths. I speak at a lot of the old ones. Yesterday I was at Cypress Senior Center. Mm-hmm. I'm in a lot of the retirement.
What about these big companies? We've had several on through the years on different programs on our station here. I'm trying to think offhand, but there's some huge companies that own a variety of these. They don't call them any. I don't know what they call them. Help me out here. What's the different levels between of senior care facilities? But they have other names for them.
Like memory care.
Well, memory care is one, but
independent living, assisted living.
There you go. Those are the magic buzzwords I've forgotten here. There's independent living. There's assisted living. You need more help, and they have all these different facilities with different levels of care in them and different levels of cost, and there's no shortage of the need. I would think they would all welcome this because they always, when I never put my aunt or my mom or my dad in any of those facilities. I got to the point where I almost did, but they were very expensive and they were reluctant to go in. They didn't really like to go there to the very end. They kept saying, don't put me in one of these places. But there's some beautiful places, and at some point people welcome the care or welcome the attention. And one of the things they advocate and one of the things they advertise is, we've got a hairdresser that comes in. We've got a dentist that comes in. We've got somebody that they're always touting to the family. We can take care of these people here. And you'd go, see, they got a dentist that comes here. Mom, why don't you want to go here?
And that's what I'm telling them. One of the last things they don't have is, dental hygiene visits.
Never heard of it. No, never heard of it.
The family members still have to come. They have to pick up, their mom and dad, bring them to their appointments still. And let's make it a full service. Let's, provide this as well.
So I think they'd be open to it. I can't imagine this wouldn't fit into their marketing of services. Why am I going to pick this facility over that facility? Because this one has it all. And I don't have, and then it's the family member who's really probably pushing them or paying the bills says, good, then they'll take care of them. I don't have to come and do all these little visits to take them to the dentist, to take them to the hairdresser, to take them to the podiatrist, to take them to all these other places here. Yeah.
Right.
Wow. I would think you would just, I don't know if they've thought of that, most of these facilities, but if you can get in to meet these people, I think they'd all embrace the idea. I can't see why they wouldn't want you to come into their facility, because they're trying to tout to the family and to the patients, we've got it all.
So how does tele dentistry work?
There's different ways of doing it. So I'm trying to think of the words right now. So there's immediate, where you're sitting there like on a call with the dentist while you're seeing the patient.
Right.
And then there's the aftercare of just sending in, the documentation after you've seen them. There are programs out there. Mouthwatch is a big program out right now. And you can have an intraoral camera that directly links to your computer, and the dentist can be sitting at home or in their office, log in and see live the image on your camera right there, and you can be discussing in a Zoom call. You have the Zoom call on your computer, and then you have the mouth camera on. You be sitting there with, the family member, with the patient, yourself, and the dentist on the call.
Wow.
And he can be looking live at exactly what he would be looking at if he were there, and he can be diagnosing and talking about the issues at hand. So that's a really handy tool. I don't have that one yet because I find it difficult to correlate having a dentist available the moment that I need them. So I find it better to take the photos, everything I know that they'll need, and then send it. But that is an option. So, these clinics and things that can hire RDHAPs and say, what, the dentist is going to be, available these hours, and they can call in and, oh, okay, I'm ready. So-and-so is ready. Can you, do the exam right then and there? It's a no-brainer.
I would think that would open up a whole different dental practice, because maybe I don't need some dentists and groups will still, obviously there'll be brick and mortar facilities, just like there's going to be brick and mortar retail of some sort where people still go, but less and less retail, less and less do I need the big floor footprint. Car dealers are shrinking. Maybe you buy it online. Telehealth, maybe shrinking the number of exam rooms I need and stuff here. And as doctors pivoted, you think they're ever going to be open, that Dr. Trinh? Is Dr. Trinh just going to sit at home and telehealth all day long? The Dr. Trins of the world, the new Dr. Trins?
Sitting at home now.
Yeah, see, there you go. I mean, dentists really have to be, their job isn't, they can't just call in prescriptions and, do stuff.
Which is what doctors do. That's all they do today is call in prescriptions. They look at you and say, I'll get you a pill for that. No problem. Next. He agreed. Oh, Dr. Trinh agreed. Okay. All right. So.
Yeah. We'll have to cross paths sometime. I'm speaking at Town and Country coming up, and a few other locations on a regular basis, the Covington.
So bring her along as
bring me along.
Come on, say we got a twofer today. I'm going to talk, and she's going to talk.
We'll do like a special guest talk.
Yeah, I love that. Just getting the exposure and getting people aware. That's the goal right now. So
huge. Yeah, much needed service. I mean, am guilty of not anymore, but it used to be a time where I went for years without dental cleaning.
Me
things
too.
of that sort.
I put it off. I
mind.
hate it. I go once every 10 years, whether I need it or not. Yeah, right.
Now I came to the dentist and I realized there's 10 things that needs to be done, right? You got cavity here, issues here, crowns broke here, right? And so I'm like, wow, this is the consequences of just neglect. And so I had all these things fixed. And since then, I've been pretty regular every 3 to 6 months just to get a cleaning. And by being regular, I just never had any additional issues since then. It's really about maintenance after that.
And I've been the opposite. Once I go, I think I'll put, and they say, come every 6 months. They're like, I don't need, that's just a marketing trick. They just want more money. That's a sucker's bet. I'm fine. I won't call them until I need them here again. I hate going to the dentist. It hurts. It's expensive. And I don't want to do it. So I just don't. I hate to say that. Yeah.
I know where Paul's located. You can come by.
Yeah. Come over to UCI. That's what I'm saying. Maybe because if you made it easier, maybe I would do it. It is a hassle.
She can come to the studio, bring her chair.
Yeah.
And
I'm afraid what she'll find. She'll look in there and she'll say, "What have you been doing here?" Yeah.
Well, we've got people in the legislature right now trying to advocate for more mobile care for those who aren't necessarily homebound, but just would rather have this service. So
who's
we're working on it.
Who's fighting it? The dentists, because they don't, now you are cutting into their bread and butter here. They want you. I assume that's the profit part of the practice. The easy part of the practice is getting them to come back and do the maintenance. And if you're going to do the maintenance, then that's like, oh, I don't know, you're going to take away my business here.
Yeah, but they make money doing, the restorative work. That's
A
you know,
lot of money.
The cleanings for them aren't as, you know, profitable. You know, they get the patients in, but I can't do the crowns. I can't do the root canals and fillings. So they do always get that business back. So it works out in the end. It works out.
But why wouldn't every legislature just sign? There must be some advocacy groups saying there must be some barriers, legal barriers that are up. No, you can't do this. And so I'm assuming there are dental, whatever you call these things, advocacy groups that are saying, no, we can't allow this. You still got to go see a dentist.
Yeah. For the majority, I would say dentists aren't aware of our capabilities, and they don't see the big picture with this yet. They're still very, you know, they have their traditional practice model and that's all they want, and they don't want to step outside of the box. So just getting them to know, you know, and to get the word out.
Tell them it's found money. It's not fear. It's found money. These are people that ain't coming in, Doc. So you're you're not only helping the population needs help. These are people you ain't going to see. They're not coming in.
You ain't going to see anyway.
Yeah, right. So it's found money.
It's a gap that needs to be fixed.
Yeah. And dentists can always hire RDHAPs to work in their office and send them out to see their patients. That's another option as well.
There you go.
And they don't have to be independent. They can hire someone to be.
Or they can contract with Brightwork, and you bring in your team for them, and you become the white label provider here. You under their auspices, you do this service for them, and they mark it up or whatever here. And
do you have a team, or is it you?
It's just me. So I started this back in August. So it's just me been going out. But like I said, I'm trying to get the word out to have other hygienists who want to get this license and start this endeavor. It's not easy, but it is rewarding, and it's for the right person. So.
Dr. Trinh is only involved in 12 other businesses, so I say he's got room to help you be a mentor, be an advisor, and just turn this into it. Because I think this seems so obvious to me. I see no downside, very little downside. I guess, you could screw up because you're there or something, but I think it's so the benefit so outweighs whatever small risk is involved here. I'd rather have somebody look at my aunt's teeth than nobody look at her.
Right. 100%.
Yeah,
absolutely.
Wow. How do we reach you other than your website? Is that the main way? Or?
So I have a phone number you can call and get a hold of. And that phone number is 562-760-3983. That's my direct line. So I have that while I'm mobile everywhere I go. And then you can email me, brightworkdentalhygiene@gmail.com, and send an email right over there. And then, like I said, I'm around the community. So you may see me, driving around. You may see my car with my mobile dental hygienist.
You need a van dressed up as a tooth. And it's like shaped as it's got a tooth around it.
So I do have a white SUV. I call it my big shiny tooth.
There,
and so I do have that. But
so you see it driving around and you go, oh, there she is again. Right. It's the mobile tooth people.
That's it.
Thank you for coming on. I think this is a fascinating idea. It's, again, another innovative way, because we're always talking about how medical practices in general, the whole health field, is trying to evolve. Is trying to handle COVID, is trying to handle expenses, is trying to handle all the things that are happening. And whether we understand it or accept it, this whole mobile telehealth is clearly part of it. And I think it's a good part of it. I'm never afraid of it. I'd be thrilled if somebody came and did my teeth at my office. It would save me time. It would probably get me over the hurdle. So let's advocate for that one. Call your congressman, call your local state senator here and say, we need mobile dental hygienists coming out to our homes here.
Well, thank you so much. I appreciate the support, and it gives me a lot of fire and energy to get out there and keep going. So
it's a great idea. I'm sure you're onto something. Like anything new, it's going to take a while to sink in, but what a need, and particularly the focus of older population. Absolutely. All right, take us out, Dr. Trinh. I don't know how you find them, but you keep coming up with these fascinating topics here.
To your teeth. Have a great day, guys. Talk to you soon.
Okay. Well, that's what we're talking about. That's why you got to tune in. If you want to hear the most innovative conversations and ideas taking place in healthcare today, to handle the challenges we all face as we get older, here's one I never thought of. Come back again and we'll show you more. We'll flash a big smile here on Health Talks, right here in Orange County's only community radio station, octalkradio.net. Streaming live from the University of California, Irvine's Beale Applied Innovation Center.